don't even know where to begin. I had my psych session earlier, where from a couple of nights ago, reading this email from a meeting they had with the hospital staff the week before, that the new director of operations, or one standing in, wanted to meet with me and to discuss things and make things better, to today being told that they were lucky to be included on this meeting that's going to decide what happens to me, because the nursing staff are so traumatised by me that they can't cope with me. And I have the option of, because we can't find accommodation, like appropriate accommodation, MTA accommodation, that to be moved to another ward here and to go back to the one that I was moved from, which the coordinated bullying and gaslighting I incurred under that ward manager, to then rostering different staff and the other option being moved into aged care. That's how much this hospital cares about patients, when all along I've been saying the nurses need help. I've been saying it since January last year. I've been wanting out since February last year. And the runaround I have experienced, that all fault goes back onto me and my mental health, when I've never once abused or yelled at a nurse. They may have reported so. They'll be those ones that have injured me, knowing that I can report them. And because I've made claims about doing that, I guess many of them have closed ranks now. And the other heartbreaking thing is that when this behavioural support plan was implemented, it was done in a way where I knew nothing about it. Yet nurses were apparently told that I did, and that my psychologist was involved. I didn't know what the routine is. I didn't know what it was. So when I had nurses saying to me, it's in the care plan and you know it. No, I don't. I didn't know what the care plan was. So imagine for a moment a person that has, well, even if you don't have PTSD triggers, as I have, or have come from an abused background, to have nurses putting up the rails on the side of the bed when I can't roll properly in that. No H and OH&S involved. That should have been primary, to work out what the best would be. Ripping out the Kylie from under me because there's no other way to get it out. Putting a bolster on a bed that's lower than the actual mattress, where I almost fell out one night and then had to sleep with the rail up. Now there's finally a mattress the right size for the bed, because I had to extend it to be able to roll. Just the way all of this has been handled. But the worst was when the first day, when I had two of my favourite nurses, and to have them do all this, and then when I'm being hoisted into the commode, nobody from the front. You need that to guide a person gently into... I was in a trauma state. I don't even remember that I was screaming, but they told me when I saw them the week later. When they came in, I looked at them with dread, because I just couldn't believe how I was treated the week before. And I just went to say, look, the way you spoke to me straight away, oh, you know, it was traumatising for us. You were screaming at us. I'm like, I wasn't screaming at you. But the fact that they took that on as me screaming at them, I'm reacting to what was happening. Like, if anybody could understand, just for a moment, what's that like for someone who's been in hospital as long as I've been? And routine is really important, especially for someone with PTSD, to know what's happening. So this plan that was implemented, it was done with a purpose, to make me react, because they have to have it. Because when they brought me up to this dementia ward, they had me on a behavioural contract even though I was the one that was bullied and gaslighted downstairs. I didn't want to come up to this ward, having heard stories from other nurses downstairs and having known that patients that were really difficult were sent up here. So the fact that I'm still sane in this insane situation, and that they're trying to blame my mental health as being this factor, when what it is I'm cognitively intact. And because I can report nurses for their behaviour towards me, I haven't done so yet, but there will be 2 that I absolutely will, because they're absolute nasty. They're nasty to me. One of them the previous week had left the curtain open, and I'm coming out of the shower and I saw the curtain open. I said, can someone shut the curtain? And then when I saw this man staring in on me, naked in the hoist, I reacted and I said, I don't want to feel, I feel like enough of a freak show as it is. And she yelled at me. And I'm pleading, saying, I just want some dignity. And she yelled at me again. And then the other nurse to the side said, Mary, you're yelling at us. And I'm, oh my God, I'm yelling. And she's not yelling. And then yelled at me, I told you the first time and you didn't listen. But it was a real, I told you the first time and you didn't listen. Like to not even apologise. And I just shut down. And I said, yelling at me is not, that's what I said. I said, yelling at me is not the way to talk. I'm traumatised. And that's when the other nurse said, Mary, you're yelling at us. Like, wow, seriously. And then afterwards, when I've asked, because I missed the lunch and I didn't want to eat what it was, I asked for a cup of tea. It was 1:30. And she said, I can't, I'm doing my notes at the moment and I haven't attended to other patients. Well, first she said, oh, the drinks trolley will be around soon. I said, no, won't be till after 2 or 2:30. Now, I just needed something to calm me down, a sense of calm. And so that week when I was in physiotherapy downstairs and I'm overhearing physiotherapists talk to another patient, and they're asking, oh, who braided your hair? And they're talking about this nurse that braided her hair. And I started crying because I thought, what have I done? Even when I've asked for cups of hot water, some of the nurses have told me they can't get that. I don't ask like when they're rushed. I don't ask. I'm always grateful. I've never been purposely rude. So the way I'm being treated at the moment by some of them is that I don't matter. That's how I feel. And that I'm treated almost with contempt, when all I've tried to do is to fight for these nurses, to make it better for them, because you have to have nurses feeling good. So that's transference to the patient as well. It's a symbiotic relationship, which I recognised from early last year. That was in January. I wanted to do my paper, my trauma certification, to assist nurses and patients. That's the one good thing that's come out of last week in talking with my wonderful coach, that she said, Mary, I'm giving you your certificate. You've lived it. You've earned it. And even in the way I spoke about how I'd been treated, especially by the OH&S person, that was disgusting. No consideration for me whatsoever. And God, I'm not laughing. This is trauma response. When I said to her, because some of the nurses, the nasty ones, wouldn't lift my leg, and I said, why, when the nurses are out there lifting up people, how is my leg heavier than a person? And she said, Mary, your weight is heavier than a person. I said, there's fat shaming right there. And she's like, oh, no. Well, you know, the lack of autonomy I have, the way she designed it with the shower, in putting the commode that my back is to the niche, that I can't reach anything, and telling me, oh, you know, we can give you things. Don't take away my autonomy. That's my self-soothe, is having a shower.